Acrodermatitis Enteropathica. That is reddening, swelling, and also pustules at finger, toes, scalp, mouth, and anus. And that is because there is an inability to absorb enough food, enough zinc from food. It is inherited. And usually supplements of zinc help. According to the Illustrated Medical Dictionary by Sue Davidson, Penny Preston, and Francis Williams on the page 10. But this is no substitute for medical knowledge and also no medical advice, and the positions and views expressed are the ones of the source and not necessarily aligned with my own or the ones of the entity spoken. Hi and welcome. I am trying to learn medicine today. Acrodermatitis Enteropathica, and after I've done that, we're gonna do Wrissttraining, and if you participate in the Wrissttraining, then it's at your own risk. And this is no substitute for medical knowledge and also no medical advice. I'm just trying to read and to understand it, and it is something about ulceration of skin and so on. So Acrodermatitis Enteropathica, and I don't even know how to pronounce it. Enteropathica. Acrodermatitis Enteropathica. That is a rare inherited disorder in which areas of the skin, most commonly the fingers, toes, scalp, and the areas around the anus and mouth, are reddened. I found a sound I can't pronounce it. Ulcerated and covered with pustules. Okay, so the fingers, toes, scalp, and other areas are reddened, ulcerated, and covered with pustules. Rare inherited. Let's take one look to pustules. Pustul, a small skin blister that contains pus. That is all what we have. A small skin blister that contains pus. Let's go to blister. Blister, a collection of a fluid beneath the outer layer of the skin that forms a raised area. A blister contains fluid that has leaked from blood vessels in underlying skin layers after minor damage and protects the damaged tissue. I read it already somewhere. Common causes are burns and friction. Blisters may also occur with pemphigoid dermatitis, herpetiformis, and some types of torhyphria and some skin diseases. These include eczema, epidermolysis bullosa, impetigo, and erythema multiforme. Small blisters develop in the viral infections chickenpox, herpes zoster, and herpes simplex. Generally, blisters are best left intact, but large or unexplained blisters need medical attention. I want to know what this porphyria is. I don't know how to write it, so I have fun. Porphyria. Porphyria, any of a group of uncommon and unusually inherited disorders caused by the accumulation of substances called porphyrins. Sufferers often have a rash or blistering brought on by sunlight, and certain drugs may cause abdominal pain and nervous system disturbances. Porphyrins are formed in the body during the manufacture of heme, a component of hemoglobin. A block in this manufacture causes a buildup of porphyrins. Such blocks are the results of various enzyme deficiencies, which are genetic disorders. Porphyria may also be due to poisoning. There are 6 types of porphyria: acute, intermittent porphyria usually appears in early adulthood, causing abdominal pain and often limb cramps, muscle weakness, and psychiatric disturbances. The patient's urine turns red when left to stand. Barbiturate drugs, phenphyluine, oral contraceptives, and tetracycline precipitate attacks. Varigate porphyria has similar effects but also causes blistering of sun-exposed skin. Hereditary coproporphyria also has similar effects and may cause additional skin symptoms. Pseudoporphyria usually causes skin symptoms after exposure to sunlight, as does porphyria cutanea tarda. In this type, wounds are slow to heal and urine is sometimes pink or brown. Many cases are precipitated by liver disease. The rarest and most serious form, congenital erythropoietic porphyria, causes red discoloration of urine and the teeth. Excessive hair growth, severe skin blistering and ulceration, and hemolytic anemia. Death may occur in childhood. Diagnosis is made from abnormal levels of porphyrins in the urine and feces. Treatment is difficult. The book is from the early 2000s or something. Avoid sunlight and or precipitating drugs is the most important measure. Acute intermittent porphyria, varicate porphyria, and hereditary coproporphyria may be helped by administration of glucose or hematine. Cases of porphyria cutanea tarda may be helped by venesection. My voice isn't strong enough for venesection, so let's go back here. Acrodermatitis enteropathica. That is a rare inherited disorder in which areas of the skin, fingers, toes, scalp, mouth, and something else are red, ulcerated, and covered with pustules. Red, ulcerated, and have pustules. I don't know how to pronounce it. Acrodermatitis enteropathica is due to an inability to absorb enough zinc from food. Zinc supplements usually help. Let's have it together. It is acrodermatitis. What does acro mean? Because the next thing is acromegaly. It has to be also enlarging of the jaw and the skull, hands, and feet. It was a tumor here, a tumor causing excessive production of a growth hormone in the pituitary gland. Acrodermatitis enteropathica. Reddening and ulcerating and pustules at fingers, toes, scalp, mouth. Inability to absorb enough zinc. Supplements of zinc can help. No, usually help. Acrodermatitis enteropathica. Reddening and swelling in the pustules at fingers, toes, scalp, mouth, and the upper finger. Acrodermatitis enteropathica. That is reddening, swelling, and also pustules at finger, toes, scalp, mouth, and anus. And that is because there is an inability to absorb enough zinc from food. It is inherited. And usually supplements of zinc help. According to the Illustrated Medical Dictionary by Sue Davidson, Penny Preston, and Francis Williams on the page 10. But this is no substitute for medical knowledge and also no medical advice, and the positions and views expressed are the ones of the source and not necessarily aligned with my own or the ones of the entity spoken. This is correct with inherited. A rare inherited disorder, I didn't say rare, but inherited. If you were here for medicine, you can go directly to the next part of medicine, where we will continue with medicine if you stay here and participate in the Wrissttraining when it's better the arms. Let's take a stand, arms up, hands form to fists, hand putting on down, hand up. And like that, in, and out. like that, in and out. And like that, and again up and down. We're having 3 rules. Hands out, down and up. The first rule is that we are stopping immediately as soon as there's pain. The second rule is that we're going only as far as we can go with a little bit of effort. Hands like that, in. And the third rule is that we're not overdoing it, we just want to strengthen, not to exhaust. You can take a break whenever you want. One hand next to the body, down, press from the inside. And pull from the side. Press on top. And forward. Other side, hand down, press from the side. And fingertips of one hand on top of the fingertips of the other hand, open and close. Change. Both hands up, bend the middle knuckles. Open again, and bend the knuckles. Open. Just make strong fists. Release, press, release. And last time. Both hands up, open, close. Extend one arm, try to flex the biceps, hand into extension, press against the back of the fingers. Other arm out, try to flex the biceps, into extension, press against the back of the fingers. And both arms up. You can take a break, down with flat fingers, up with strong fists. Down and up. And now both hands up, claw them and try to flatten them apart or spread them apart. Open again and claw. And open, last time. One hand up, bend it at the knuckles, press onto the forefingers. Change. Other hand up, bend, press onto the forefingers. And open. And both arms up, strong fists into flexion. Out extension, flat fingers. In strong fists, flexion. Out extension, flat fingers. And both arms up, strong fists into flexion. Down. Turn it around. Down. And again up. One more time around. Down. And up. Long arms, strong fists into flexion. Out extension, flat fingers. Now you can use the sock, have the long arm at the outside, let it fall down, try to catch it again. Other hand. And now one arm in. First one hand, make us do it carefully. Strong fist, down and to the inside. And then go over at here. That should not cause pain or anything or discomfort. And relax. Strong fist again, down and radial deviation, sort of inside to you, and go with from over it. Again, no discomfort or pain. And with the other hand, strong fist, down, inside, and go over it. And again, strong fist, down, in, and go over it. And just loose the hands, And now go with moderate pressure over the middle part of the lower arm. And on the other side. And now go softly, don't pull at the fingers, over the fingers. Start here at the beginning of the metacarpal, it's a complete tendon. Don't pull at the fingers. No big pressure. And also on the other side. And that was the wrist training. Thank you very much, and until next time.